Lucas Duits. I'm a gastroenterologist at the Amsterdam University Medical Center in Amsterdam, the Netherlands. So the number of patients with Barrett's esophagus is quite high, and the burden of endoscopic surveillance is also very high, but we know that the actual number of Barrett's patients who would progress to advanced neoplasia is very low. So we are surveying a lot of patients with Barrett's esophagus who would never progress to high-grade dysplasia or cancer. This is a great burden on the endoscopic resources, but also for the patients. So we need to target our endoscopic eradication therapy and our endoscopic resources to those patients who are truly at risk. We know that clinical guidelines recommend expert pathology review for low-grade dysplasia, but this is a problem because expert pathology is not defined and it's not easily accessible in all settings. So we need an objective test to use this and stratify patients with low-grade dysplasia. We previously did a study on this spatial omics test, TissueCypher, where we looked at clinical validity of using the test in Barrett's patients with low-grade dysplasia. And we saw that it outperformed most of the pathologists, and especially also the expert pathologists. But in this study we were more interested in the clinical utility of the test. So we did simulation testing to see what the clinical impact of using this test on the patient care of Barrett's with low-grade dysplasia was. So the main outcome of the study was that guidance from TissueCypher for patients with Barrett's esophagus and low-grade dysplasia would result in increased number of patients who would receive appropriate management according to their known outcome. So this means that there's an increased percentage of patients who progress to neoplasia who would receive endoscopic eradication therapy, and also an increased percentage of patients who would not progress that would receive a long interval surveillance. The main reason for that is that the pathology review is highly variable. So it depends on which pathologist would review the slides with low-grade dysplasia, what the outcome would be. With the spatial omics test, the outcome is very objective and reproducible, which reduces the variability of the pathology review. So this is really a study where you can appreciate the clinical utility of the test. So if you have a patient with low-grade dysplasia, the guidelines would recommend pathology review. If you don't know which pathologist to send your slides to, well, a second review of the slides by any pathologist would probably help a little bit. But if you then add the guidance from the test, you would really have an answer to if you need to treat this patient with endoscopic eradication therapy, or if you are safely referring this patient to a 3 to 5 year surveillance interval.